Hello, and welcome to another PEHP Wellness webinar. This is Stan from PEHP Healthy Utah, and today's webinar is titled Know Your Numbers, Get Back on Track. The Healthy Utah testing staff and I are going to talk about the importance of getting regular preventive tests and exams. We will also address what your numbers say about your health and offer suggestions to either improve your numbers or maintain healthy numbers. At a Healthy Utah testing session appointment, you will receive cholesterol and glucose testing, body composition analysis, blood pressure measurement, and a consultation with a health specialist, all free of charge for qualified employees and eligible spouses. We will now go into each of these tests.
Hello everyone, my name is Brittany and I'm going to talk about cholesterol and ways to manage your cholesterol. Why is managing cholesterol important? According to the CDC, about 38% of American adults have high cholesterol, a total blood cholesterol of over 200. Nearly 93 million U.S. adults aged 20 or older have high cholesterol. Since high cholesterol doesn't have symptoms, many people don't know their levels are out of range. So, what exactly is cholesterol? Cholesterol is a waxy substance assembled in the liver and released into the bloodstream. Your liver makes all the cholesterol you need. Additional cholesterol comes from the foods you eat. Animal products such as meat, poultry, and dairy products. Cholesterol does serve a purpose. The body needs cholesterol to form cell membranes, aids in digestion, and converts vitamin D in the skin and makes hormones. At the Healthy Utah testing session, we check your total cholesterol, HDL cholesterol, and calculate your ratio with a rapid test by way of a simple finger stick.
Cholesterol. It may surprise you to know that cholesterol itself isn't bad. In fact, cholesterol is just one of the many substances created and used by our bodies to keep us healthy. So what is cholesterol exactly? And where does it come from? Cholesterol is a soft, fat-like substance found in the bloodstream and in all your body's cells. Your body makes all the cholesterol it needs. Low-density lipoprotein, LDL, or bad cholesterol, can join with fats and other substances to build up in the inner walls of your arteries. The arteries can become clogged and narrow, and blood flow is reduced. High-density lipoprotein, HDL, or good, carries harmful cholesterol away from the arteries and helps protect you from heart attack and stroke. It's important to know your cholesterol levels and to talk with your healthcare provider. There are some key tips for success to help keep your cholesterol levels in check. Try eating a diet rich in fruits, vegetables, whole grains, low-fat dairy products, poultry, fish, and nuts, while reducing red meat and sugar foods and beverages. Try getting more active. Enjoy at least 150 minutes per week of moderate activity or 75 minutes of vigorous activity spread throughout the week to help manage cholesterol. Finally, always remember to talk with your own medical provider to discuss the best plan of action for your health.
Your total cholesterol is a measurement of four components: HDL, LDL, VLDL, and triglycerides. A total cholesterol level less than 200 milligrams per deciliter is considered a desirable level for adults. HDL, or high-density lipoprotein, is the good cholesterol. It removes excess bad cholesterol from the bloodstream and the artery walls. An HDL cholesterol level of 40 milligrams or above is considered desirable. Your cholesterol ratio is calculated by dividing the total cholesterol by the HDL. An optimal ratio is at 5 to 1 or below. Ratios 5 to 1 or less show you have a correct proportion of good cholesterol to total cholesterol. At the testing session, if you find your cholesterol levels are out of range, make an appointment with your provider to find out about additional cholesterol levels through a full lipid panel. Those other levels you will be tested for include LDL cholesterol, low-density lipoprotein, considered the bad cholesterol. Too much LDL contributes to plaque formations in the arteries, which narrow the arteries and increase risk for heart attack, stroke, and peripheral artery disease. An LDL level below 130 is desirable. Triglycerides are a type of fat found in your blood. When you eat, your body converts excess calories it doesn't need right away into triglycerides. Triglycerides are stored in your fat cells as excess energy, and later, hormones release triglycerides for energy between meals. A normal triglyceride level is less than 150. When triglycerides are high, greater than 200, coupled with high LDL and/or low HDL, a greater risk of increased fatty deposits within the artery walls exists. VLDL, or very low density lipoprotein, is similar to LDL. LDL carries cholesterol to your tissues, whereas VLDL cholesterol carries triglycerides to your tissues. You might ask, isn't my cholesterol test at the testing session sufficient? Even though our rapid test has a clinically equivalent values when compared to the same patient samples analyzed in a reference laboratory, it is important to check in with your healthcare provider periodically to have a full lipid panel test performed through a blood draw. The American Heart Association recommends adults over 20 have their cholesterol checked every 4 to 6 years as long as other risks remain low. People with cardiovascular disease or high cholesterol may need their cholesterol checked more often. PEHP offers annual cholesterol checks at the Healthy Utah testing sessions. Your lifestyle choices can increase your risk for high cholesterol. Eating a diet high in saturated fat and trans fat may contribute to high cholesterol and heart disease. Saturated fats, and especially trans fats, are difficult for our bodies to process and increases LDL production. Not getting enough physical activity can increase body fat, lower your good cholesterol, and raise bad cholesterol. Smoking damages your blood vessels, making them more likely to collect fatty deposits. Smoking can lower HDL and increase LDL. If you don't smoke, don't start. If you do smoke, you can learn more about tobacco use and ways to quit at CDC's Smoking and Tobacco Use website. More information can also be found at pehp.org if you search Tobacco Quit Line. Risk for high cholesterol may increase with age. Our bodies can become less effective at clearing cholesterol from the blood, which raises the risk of heart disease and stroke. After menopause, women tend to have an increase in LDL and a decrease of HDL, as estrogen levels decrease more so than men of the same age. However, at any age, men tend to have lower HDL than women do. There are 4 main ways to help prevent high cholesterol. Number 1, eat a heart-healthy diet. Number 2, get moving, increase your physical exercise. Number 3, maintain a healthy weight. And number 4, if you smoke, stop smoking. There are 3 ways to increase your HDL. Add healthy fats, monounsaturated oils found in olive oil and avocados, omega-3 fatty acids found in oily fish like salmon or tuna, nuts and seeds like flax and chia. Regular exercise. 3 ways to decrease your LDL. Eat a diet low in saturated fats. Add fiber to your diet, whole grains, fruits and veggies, and fiber supplements. Keep clear of trans fats, which are highly saturated fats found in many store-bought foods like cakes, cookies, crackers, and chips. You can lower your triglycerides by exercising regularly, avoiding excess amounts of sugar and refined carbs, choosing healthier fats, and limiting how much alcohol you drink. Often your family genetics may override your healthy habits. Some factors can't be changed. That's where medications can come into play. If you have incorporated healthy habits and your cholesterol is still high, your provider may suggest medication to lower your cholesterol. The most common type of cholesterol medication that a doctor will prescribe are statins. These interrupt the assembly of cholesterol in the liver to reduce the cholesterol output. It also causes the LDL, the bad cholesterol, to return to the liver to be digested. It is important to understand that most cholesterol medications are prescribed with lifestyle changes, including added exercise and diet changes. So, to benefit the most from your cholesterol medication, it is important to apply these changes as well.
Hello, this is Shelley, and another important test performed at the Healthy Utah testing session is a blood glucose or blood sugar test. Blood glucose testing is important because it detects the amount of glucose in your blood. Elevated blood glucose levels may indicate the possibility of either pre-diabetes or diabetes. Here is a short video with an overview of how our blood sugar affects our health.
Did you know you can lower diabetes and heart disease risks by controlling your blood sugar? Heart disease and stroke are the #1 killers among people with type 2 diabetes. Blood glucose, or sugar, is an important fuel for your body. When it's at the recommended level, that's normal. But when it's too high, that can lead to diabetes. Insulin is a hormone that is important for controlling blood glucose levels. But if your glucose levels become too high or too low, your body can have trouble producing a hormone called insulin that it needs to stay healthy. When your body doesn't produce enough insulin, or it doesn't efficiently use the insulin it makes, your blood sugar may become too high. When this happens, your body's cells cannot use the sugar in your blood, and the cells can be starved for energy. Over time, high blood sugar levels can damage your eyes, kidneys, nerves, or heart. You can lower your blood sugar by eating better. Eating a diet full of fruits, vegetables, whole grains, low-fat dairy products, poultry, fish, and nuts, while limiting sugary foods and beverages to promote a healthy lifestyle. Finally, always remember to talk with your own medical provider to discuss the best plan of action for your health.
At your Healthy Utah testing appointment, blood glucose is tested with a simple finger poke and a glucometer. You may have a friend or relative with diabetes who uses a glucometer to test their blood sugar levels. Results are available in seconds. We prefer that you come in fasting for at least 4 hours. A short 4-hour fast can indicate how your body is processing carbohydrates and sugars. Ideally, after a 4-hour fast, your level should be under 100 milligrams per deciliter. However, if your level is over 125, we will perform another test that measures a 3-month average of your blood glucose level. This test is called a hemoglobin A1C test. If you happen to come into your appointment without fasting for 4 hours, that's okay. A normal non-fasting blood glucose level should be under 140 milligrams per deciliter. But if you are over this amount, we will test your A1C level. A normal A1C reading is below 5.7%. An A1C reading of 5.7 means that your daily blood sugar is 126, which is too high. We would encourage you to visit your provider about any numbers 5.7 or higher. We do not diagnose your condition at the testing session, so please visit your provider. Your physician will want to confirm your glucose and A1C levels and then may order additional testing to diagnose your condition. A commonly used test to determine if you have diabetes is called a glucose tolerance test, or GTT. A GTT is performed at the doctor's office. You will drink a sweet beverage and then your glucose levels are tested at various intervals to see how quickly glucose clears your blood. Besides diabetes, a GTT is also used to test for insulin resistance, impairment of beta cell functioning, and hypoglycemia or low blood sugar. If you are diagnosed with diabetes, your doctor may either suggest changes to your diet and lifestyle and/or may prescribe medication to help your body lower glucose production in the liver and improve insulin sensitivity. Knowing your numbers and avoiding diabetes is so important. Having uncontrolled diabetes will cause far-reaching consequences for your health, quality of life, and even your finances. Diabetes greatly increases your chances of developing cardiovascular disease, peripheral artery disease, stroke, kidney disease, nerve damage, vision problems, slow healing and infections, and metabolic syndrome. So what can you do to prevent or delay the onset of diabetes or help control prediabetes or diabetes? First, reach and maintain a healthy weight that's for you. Eat a healthy, balanced diet, low in refined carbs and starches. Increase lean proteins. Watch your portion sizes and drink plenty of water. Get regular exercise, at least 150 minutes of moderate intensity per week. Strength train. And If you smoke, stop smoking. So you see that one small droplet of blood can tell a lot about your health. Avoiding and/or controlling diabetes and its health complications are vital to you, even from a national standpoint. See your physician and work out a plan that is best for you.
Hi, this is Patrick, and I will be talking about body composition testing. A body composition test gives you much more insight about your weight than calculating your body mass index, or BMI. BMI is a height-to-weight ratio, whereas body composition testing tells you the proportion of your fat and non-fat mass in your body. Most health experts tell us that a BMI under 25 is healthy, but BMI doesn't always paint the whole picture. For example, Aaron Rodgers is 6 feet 2 inches tall and weighs 225 pounds and has a BMI of 28.9, which would put him in an unhealthy weight. However, a body composition test reveals that his body fat is a very healthy level of 12%. A healthy body composition is one that has a lower percentage of body fat and a higher percentage of non-fat mass. Decreasing body fat can help improve quality of life. A higher than recommended body fat percentage, above 25% for men and above 32% for women, can put you at risk for health issues including type 2 diabetes, coronary artery disease, heart disease, high blood pressure, stroke, hormone imbalances, pregnancy complication, kidney disease, liver disease, and cancer. You might wonder, what should my body fat percentage be? Recommendations for body fat are different for various populations, gender, and ages. There really aren't any straightforward recommendations for the various body composition numbers because we are all so physically different. Use a body composition test to track your progress and make it a challenge to improve areas that will improve your health. There are different ways to measure body fat percentage. Underwater weighing is very accurate, but requires a large submersion tank and can be an uncomfortable experience for the person being weighed. The BodPod uses air displacement to measure body composition and is highly accurate, quick to administer, comfortable, but requires very expensive special equipment. The DEXA body scan is the gold standard for measuring body composition. It uses low-level x-rays to directly measure body fat, muscle, and bone in your body. Advantages of this scan is it gives the most accurate details of your body composition. Skin-fold calipers are small clamp-like devices that determine the amount of fat you have lying just below the skin by taking skin fold measurements at various locations on your body, such as the back of your arm and your waistline. Health professionals use this skin fold measurements in equations to estimate body fat. Calipers are relatively inexpensive but require a trained individual to use them. Bioelectrical impedance. This method works by measuring the speed of an electrical current as it travels through your body. It is one of the least expensive and portable methods to measure body fat. It is less subject to human error than calipers, and it is the method used at Healthy Utah sessions. Over the next few minutes, we will be going over the terms that are on your tinnitus scale printout, the one that you get when you come to a Healthy Utah testing session. The first term is FFM, or fat-free mass. Fat-free mass is comprised of muscle, bone, tissue, water, and all other fat-free masses in the body. Muscle mass. Muscle mass is the total pounds of muscle of your total weight. Muscle plays an important role as they act as an engine in consuming energy. As your muscle mass increases, your energy consumption increases, helping you reduce excess body fat levels and lose weight in a healthy way. Total body water percentage, or TBW, is the total amount of fluid in your body expressed as a percentage of your total weight. Water plays a vital role in many of the body's processes. Maintaining a healthy total body water percentage will ensure that the body functions effectively and will reduce the risk of developing associated health problems. Where your water percentage should be: for females, 45 to 60%, and males, 50 to 65%. Bone mass. Research has shown that exercise and the development of muscle tissue are related to stronger, healthier bones. While bone structure is unlikely to make notable changes in a short period, it is important that you develop and maintain healthy bones by having a balanced diet and plenty of exercise. People worried about bone disease should consult their physician. Basal metabolic rate, or BMR, is the minimum level of energy your body needs when at rest to function effectively, including your respiratory and circulatory organs, nervous system, liver, kidneys, and other organs. You burn calories while sleeping. About 70% of calories consumed every day are used for your basal metabolism. In addition, energy is used when doing any kind of activity. However, the more vigorous activity it is, the more calories are burned. Metabolic age. Metabolic age uses your present body fat, muscle mass, and visceral fat to calculate your basal metabolic rate compared to the average age associated with the type of metabolism. If your BMR age is higher than your actual age, it is an indication that you need to improve your metabolic rate. Increased exercise will build healthy muscle tissue, lower your visceral fat and body fat percentage while improving your metabolic age. Visceral fat is the fat that is in the internal abdominal cavity surrounding the vital organs in the trunk area. Research shows that even if your weight and body fat remain consistent, as you get older, the distribution of fat changes and is more likely to shift to the trunk area, especially post-menopause. Having a healthy level of visceral fat may reduce the risk of certain diseases such as heart disease, high blood pressure, and onset of type 2 diabetes.
A body composition scale is a great way to monitor your body fat percentage. And an expensive and effective way to monitor yourself is by periodically measuring your waist. The best time to measure your waist is in the morning before you've had any food or water. An unofficial rule of thumb is 1 inch on the tape gained or lost equals 5 pounds of fat. Now, Sarah will demonstrate how to properly measure your waist.
Hey everyone, my name is Sarah from PHP Healthy Utah, and today I'll be teaching you how to measure your waist circumference because it's another great way to measure body composition. The first thing you're going to need is a flexible measuring tape like I have here, and you're going to place it either at the narrowest portion of your waist or right above your belly button. And then, either with another person or a mirror, you are going to make sure that it is straight across in that area. You're going to take a deep breath in, breathe out. When you're breathing out, you're going to make sure the tape is snug but not too tight, and where those markers line up is going to be your waist circumference.
Hello everyone, my name is Sarah, and during your Healthy Utah testing appointment, we will check your blood pressure. Knowing your blood pressure number is important. I'll be helping you understand those numbers. To better comprehend how blood pressure works, first let's watch a short video.
These tissues. All that blood exerts a force on the muscular walls of the blood vessels. That force is called blood pressure, and it rises and falls with the phases of the heartbeat. It's highest during systole, when the heart contracts to force blood through the arteries. This is your systolic blood pressure. When the heart is at rest between beats, blood pressure falls to its lowest value, the diastolic pressure. A typical healthy individual produces a systolic pressure between 90 and 120 millimeters of mercury, and diastolic pressure between 60 and 80. Taken together, a normal reading is a bit less than 120/80. I'm resilient. But if your blood pressure regularly rises above about 140/90, what we call hypertension, and stays there, it can cause serious problems. That's because the extra strain on the arterial wall can produce small tears. When the injured tissue swells up, substances that respond to the inflammation, like white blood cells, collect around the tears. Fat and cholesterol floating in the blood latch on too, eventually building up to form a plaque that stiffens and thickens the inner arterial wall. This condition is called atherosclerosis, and it can have dangerous consequences. If the plaque ruptures, a blood clot forms on top of the tear, clogging the already narrowed pipe. If the clot is big enough, it can completely block the flow of oxygen and nutrients to cells downstream. In vessels that feed the heart, that will cause a heart attack when oxygen-deprived cardiac muscle cells start to die. If the clot cuts off blood flow to the brain, it causes a stroke.
Normal blood pressure is 120 or less systolic and 80 or less diastolic. Numbers greater than 120 systolic and 90 diastolic are considered high. If your numbers are elevated at the testing session, it doesn't necessarily mean that you have high blood pressure or hypertension. Only your doctor can diagnose you as having high blood pressure. Be sure to follow up with your provider if either of your numbers are out of range. Did you know that 63 million people in the United States, that's 1 out of 3 Americans, has high blood pressure? And only about half of those people have their high blood pressure under control. 20% of the 63 million don't even know they have high blood pressure. Here are some alarming statistics about high blood pressure. High blood pressure contributes on average to 1,000 deaths per day. You are 4 times more likely to die from a stroke, 3 times more likely to die from heart disease, and then statistics show that 69% of people that have high blood pressure have a heart attack, 77% of people have a stroke, and 74% of people have chronic heart failure. In the U.S., the annual estimated cost associated with high blood pressure is $51 billion and $47.5 billion in direct medical expenses. The good news is, on average, reducing your blood pressure by 12 to 13 points can reduce your chance of having a stroke by 37%, having coronary heart disease by 25%, dying from cardiovascular disease by 25%, and death from all causes by 13%. High blood pressure is considered the silent killer. Most of the time there are no obvious symptoms, and the damage being done takes place over time. When left untreated, the damage that high blood pressure does to the circulatory system is a significant contributing factor to heart attack, stroke, and other health threats. Those other health threats to you and your quality of life include heart failure, kidney disease or kidney failure, vision loss, sexual dysfunction, angina, microvascular disease, and peripheral artery disease. How can we avoid high blood pressure and its consequences and live a healthier life? You can take steps to prevent the silent killer by eating a well-balanced diet low in salt, limiting alcohol consumption, avoiding overuse of caffeine, stop smoking if you're a smoker, getting regular physical activity, maintaining a healthy weight for you, and managing stress. Those of you who have high blood pressure should follow these same preventative steps along with taking prescribed medications to help manage your blood pressure. Also be sure to check your blood pressure regularly, fill your prescription on time and take your medication as prescribed, and regularly check with your provider.
Managing your blood pressure is a lifelong commitment. You and your doctor are partners when it comes to your health. Make sure to educate yourself on high blood pressure, regularly check your blood pressure, and adopt a heart-healthy lifestyle. While heart disease is still the #1 killer in the U.S., an ounce of prevention is worth a pound of cure.
Throughout this presentation, you may have noticed common recommended lifestyle behaviors that help prevent chronic disease. Healthy diet, regular physical activity, and visiting your healthcare provider for age-related preventive exams and tests. PEHP Health and Benefits has a variety of preventive services for you to take advantage of. Visit the PEHP website to learn more. Thank you for watching.